Now, the United States of America has detected the first case of the new Omicron variant in California. It's understood the fully vaccinated patient returned to California from a trip in South Africa. Our U.S. correspondent Simon Marks joins us now from Washington to give us details on this particular development. No doubt a worrying situation, Simon, albeit only one case at the moment. The precautions that the U.S. government is looking to take to make sure that they can curb the spread of this recently discovered variant, which our scientists here in South Africa have said is rapidly becoming a dominant variant.
Yeah, absolutely. I mean, the White House and indeed President Biden himself had said that it was inevitable that Omicron would reach the United States. And we've had within the last hour the confirmation that this first case has been identified. A traveller who returned to the United States from South Africa on November the 22nd, but who did not test positive for COVID-19 until 1 week later, November the 29th, at which point the Centers for Disease Control, in partnership with the San Francisco Department of Health, sequenced the test and realized that this was the first case of Omicron in the United States. They say that the traveller, like so many in South Africa who have had Omicron, is so far exhibiting only mild symptoms and is on the path to recovery. The traveller is self-isolating, but there's no question that this is a moment in the United States. It certainly led to Dr. Anthony Fauci, President Biden's chief medical advisor, being peppered with questions from White House reporters about how Americans should react. He urged Americans to take advantage of the booster shots that already exist for COVID-19. He said Americans should not wait for the emergence of any future booster shot that may specifically address the Omicron variant. He says they should get those booster shots right now. This particular patient in San Francisco was fully vaccinated but not boosted. Remember, at the moment, the definition here of full vaccination is having had the two-shot regimen but not the booster shot. At some time pretty soon, it's clear that that legal definition is going to change. As for travel restrictions and the impact of all of this on them, well, Dr. Fauci said during the course of the briefing that he hoped that the travel ban in place against visitors from South Africa would prove to be temporary. It is reported here that possibly as early as tomorrow, President Biden will announce plans to tighten the testing regimen that exists here. Instead of asking travellers on flights to test negative for COVID-19 within a 72-hour window of their departure for the United States, they're thinking of tightening that up and making it a 24-hour window. But there are still questions about why there is no mandatory quarantine here until after travellers test negative once they've arrived in the United States. That's something they've been thinking about at the White House, but enforceability of that kind of move in the United States would, I think, be very, very complex.
Right, Simon. So we don't know the severity or the impact that this new variant could have when it comes to people getting ill. But I wonder, is the United States, apart from the booster shot, comfortable with the fact that citizens won't be overburdening health facilities should there be a breakout, because many of them have been fortunate enough to get vaccinated, unlike developing countries like South Africa?
Well, I think the reality here is somewhere in the middle of those two realities, because at the moment only, and I realise the word only is a stretch, but only 60% of Americans are fully vaccinated against COVID-19. We've not seen the pickup in vaccines here anywhere approaching the rates that countries in Europe, for example, have managed to achieve. And remember, the vaccine is fully and freely available here. Anybody who wants to get vaccinated and boosted absolutely can. So there are concerns anyway in the United States about the relatively low level of vaccination that has been achieved here, given the opposition to vaccines from really refuseniks at this point, people who are absolutely simply adamantly opposed to getting those jabs. And that's one of the reasons why President Biden and his top officials relentlessly every single day, and Dr. Fauci was doing it again within the last hour, urge people to take advantage of the vaccine. So that is still a big problem here in the United States. At the moment, 99.9% of cases of COVID-19 in the US, which is still taking over 800 lives a day in America, are of the Delta variant. The concern now, of course, will be that that number wanes and Omicron starts spreading more rapidly even than Delta did in the past. So all sorts of questions, of course, about the severity of it, given that the vast majority of cases that have been witnessed have been mild outside the United States, and this first case in the United States is mild too, but a worrying development for public health officials here as we head into the holiday season, which of course will see huge amounts of fresh travel, both from international arrivals to the United States and Americans themselves travelling all over the country.
That's a very important point, Simon, that you've brought up, because we're speaking about the measures that the US is saying it's going to be putting in place to make sure that it contains this variant as best as it can. You've spoken about the testing regimen that is set to be implemented. South Africa is on the red list when it comes to travel to the United States. And then we also saw on Sunday, Canada reported some cases of this new variant. So when we speak about travel, particularly in the holiday season, are there any other countries, Europe or otherwise, that are on the United States' red list? So if you could just give us a refresher on that in terms of the restrictions on travel that the US is putting in place from different travelers.
Well, just to be clear, there is a distinction between the red list in the United States and travel bans. So the red list, which is maintained by the State Department, and a separate red list maintained by the Centers for Disease Control, was only last night expanded to include Niger, Poland, Papua New Guinea, anywhere with a high rate of COVID-19. Americans are advised, as a result of that red list designation, not to travel to those countries, but they're not banned from travelling to those countries. The travel ban that President Biden implemented against South Africa and other countries in southern Africa, that's a ban. That says that only American citizens or green card holders, permanent residents of the United States, from those countries can travel into the United States. And there were questions today for Dr. Fauci about why countries including Zimbabwe, Namibia, Mozambique, where they've had no cases of the Omicron variant, why are they banned from travelling to the United States alongside South Africa? And Dr. Fauci, who had said that he hoped the South Africa ban would be temporary, went on to say that he hoped that for those other countries things could be fixed as soon as possible. But there's been a long-standing contradiction in American policy here. For months, the United States has said to people like myself, British passport holders living in the United States, it's too dangerous to go to Britain. It's a red list country. You really shouldn't go. But they've had absolutely no restrictions or warnings whatsoever on me, for example, leaving Washington, D.C. and travelling to Florida, which had much higher rates of the Delta variant than the United Kingdom. And even today, Dr. Fauci insisted there's no suggestion that there's going to be any testing requirement for domestic travel within the United States, even though it's absolutely apparent that's how these variants largely spread.
Very interesting insight, Simon, and I'm just wondering if there have been ever any conversations around interstate restrictions on travel. Here in South Africa, we do intra-provincial lockdowns where we can't travel into other provinces. And just based on that last point that you've mentioned there around the variant spreading through domestic travel, are there ever any conversations around interstate travel and perhaps restricting those movements?
Yeah, it's a really interesting and very complex political question here. When New York was the global epicenter of COVID-19 back in early 2020, at one point, the governors of New York, New Jersey and Connecticut, three neighboring states there on the East Coast, talked about the possibility of restricting travel inside and out of those three states, but they were only offering recommendations and guidelines. There was never anything that was absolutely rigidly enforced, and that goes to the heart of the fact that, you know, we often think of the United States as being one country, but in fact it's 50 individual states, and each one of those states has a substantial degree of sovereignty when it comes to making decisions about health and transportation and travel. And, you know, as we've seen through the debate over vaccines and vaccine mandates that the Biden administration has sought to introduce, there are so many Americans that argue that this is an assault on their constitutionally protected freedoms, that as a result, COVID-19 has been given the freedom to travel through the United States because those kind of rigid controls simply haven't had an opportunity to be imposed here politically.
Where are we with those vaccine mandates, Simon Marks, in terms of those discussions and implementing them on certain activities or certain places that people may visit, whether it be restaurants or hospitals or shopping centres? Has there been any guideline in terms of the direction that the United States government will be taking when those are eventually implemented?
Well, again, there's a distinction between what the federal government can do and what each individual state can do. In individual states and in cities like Washington, D.C., it falls to the local governor or here the local mayor to make decisions about what requirements should or should not be in place. What President Biden has tried to do is force private employers with more than 100 people on their payroll to require vaccination or the weekly production of a negative COVID test. Otherwise, you get fired. The courts, however, have put a hold on that. The Biden administration keeps losing in various courts as it tries to argue the legality of that vaccine mandate. And there's no question that that case is going to end up in the hands of the US Supreme Court. It will be months before we get a verdict on the constitutionality of what the Biden administration has been trying to do in that regard. And for now, at the moment, the law is absolutely on hold.
A final thought from you, Simon Marks. The world is shining a spotlight on HIV/AIDS today, this World AIDS Day. And we've spoken about in South Africa how it's become increasingly difficult for us to focus on those living with HIV and AIDS because of the advent of the pandemic. What is the situation like in the United States?
Yeah, I think that's absolutely right. I mean, there's no question that this year, as last year, this World HIV/AIDS Day has taken a back seat to the focus that is placed on the pandemic. I mean, here in the United States, antiretrovirals are much more available than they are in parts of the developing world, and therefore many people in the United States for whom a diagnosis of HIV/AIDS back in the 1980s would absolutely have been a death sentence, they now find that they are able to live very expansive, semi-normal lives, that their life expectancy is not dramatically different from the life expectancy of anyone else. And to some extent, with a view to the pandemic, that does provide some evidence to suggest that science and the creation of vaccines and therapeutics can ultimately help beat back the crisis that COVID-19 has created. The difficulty that the United States now faces, and it wasn't facing this in the 1980s and 90s when HIV therapeutics were being researched, is that you just have this tremendous amount of political skepticism towards medical experts, towards science, and that is redolent of the political divide here in the United States between people who largely believe in facts and people who largely hew towards conspiracy theories. And that is going to be very problematic for this country for many years to come.